So the moment I realized something was wrong with Sassy was when my daughter came running to me, crying, letting me know that Sassy wasn't walking. Immediately was triggered and I knew something was wrong because she does have a history of having some hip problems and back problems. So I ran out of my room and I went to go check on her. What made me decide to come to SEVN, first of all, I work here, so that is a very good perk to have when it comes to having a neurologic problem with your own personal pet. But as soon as I saw her extremely painful to the point where she was barely walking, her back was hunched. When I did try to assist her to walk, she was dragging her right back leg. That was immediately, okay, I need to bring her in to be evaluated by a neurologist. My emotions on the way to SEVN was very kind of more nervous than anything, just because you don't really see a disc problem in cats. I've probably worked for SEVN for 8 years and I've seen like 4 or 5 in the 8 years. So the fact that it was a possibility of her having a disc was very low. So in my mind, I was thinking maybe it was something else. Could have been cancer, could have been ortho. Actually ended up being 2 discs, which is not common for a cat to have 1, so imagine having 2. The tests that were done to figure out what was happening with Sassy was we needed to start with a baseline of pre-anesthetic, so we performed some blood work, we performed some x-rays, and actually in her x-ray you were able to see a very small calcified disc in her lumbar spine. Aside from that, we did perform an MRI of her TL spine, which initially proved the diagnosis of her having 2 disc ruptures. Well, it led to Dr. Wong having a conversation of my options, and then we decided to move forward with surgery. The diagnosis that we received for Sassy upon performing her MRI was that she did have 2 herniated discs at T13 to L2. Specifically right-sided, so she did undergo a hemilemonectomy in that side. Ultimately, it was the best decision for her care because she is doing great now, she's recovered, and we're just moving forward and trying to avoid her from jumping and doing any rough play, which is, you know, hard for a cat, but we're managing. Sassy's recovery journey was a little bit challenging because it is a cat, you know, it's hard to restrict them from jumping and running, and her litter box has like a huge step into it, so I kind of had to crate her in my dog's crate. I do have a large dog, so I kind of put her in her crate with a litter box, kept her in there for 3-4 weeks, and she actually did very well since she was on pain medications. It kept her very calm. Today, Sassy is walking, thankfully. Before surgery, she was dragging her right back leg, but today she is walking. She does have a weird walk to her, which is her normal prior to this whole incident happening. We're still restricting her jumping and her playing, but she is walking, she's playful, she's happy, has a little sway to her walk, but you know, that's just her. That's gonna be her normal, and I'm okay with that. If I saw someone going through a similar situation, I would tell them that they're in great hands. I know I was when I had this problem with Sassy, so they're in great hands. I would reassure them that we provide them the most quality care for their patient. And I've actually told clients that now that I've been through it myself, I can use my personal experience with clients and just let them know, like, it's gonna be okay. I know it's very stressful in the moment, but we're here to answer any questions that they may have and reassure them that their pet is gonna have the utmost care.